Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
If there is very difficult intubation, then the laryngoscopes used for very difficult intubation. One, Mccoy Laryngoscope. In Mccoy Laryngoscope, the tip of the blade is movable. It can be used for difficult intubation. Second, external manipulation of the larynx. Tip of the blade is actually movable in Mccoy Laryngoscope. The second type is external manipulation of the larynx. On external manipulation of larynx, the larynx can be moved backwards, upwards, rightwards, or pressure can be applied on the larynx also. Stylet or hockey shaped stylet it can be used for difficult intubation. Bougie can be used for difficult intubation. Bougie is a thin tube which can be put prior into the trachea, and taking it has a support. You can put the endotracheal tube through this bougie. Then 5, video laryngoscope is available. In video laryngoscope, the success rate for failed intubation with the help of direct laryngoscopy is 95%. Like, if you have done direct laryngoscopy and through direct laryngoscopy you could not intubate, in such cases the success rate of video laryngoscopy is 95%. 6, flexible fiber optic laryngoscope. Flexible fiber optic laryngoscope is called as awake intubation. So if there is any difficult intubation, so in conditions of difficult intubation, we have 6 things. One, we have Mccoy laryngoscope can be used. In Mccoy laryngoscope, the blade of the Mccoy laryngoscope is movable. Second, external manipulation of larynx is done. In the external manipulation of larynx, the larynx is pressed backwards, upwards, and rightwards. Pressure is applied on the larynx so that the intubation can be done easily. Third, stylet can be used. Fourth, bougie. Fifth, video laryngoscope is available. In video laryngoscope, the success rate of video laryngoscope with direct laryngoscopy is around 95%. So we can use video laryngoscope and do intubation in case of difficult intubation. And flexible fiber optic laryngoscope is also available. In flexible fiber optic laryngoscope, we can even do intubation of an awake patient is also done with flexible fiber optic laryngoscope.
thank you and thank you for watching.